So you're going to get this test kit. I'm going to test myself for you real quick here. And it's going to have everything you need. I put it all together. I knew what to order, right? First of all, you have gloves. If you're squeamish about a pinprick, someone else wants to test you, that's fine. I don't really use it, but you can use it. Here's the actual test right here. It is on the FDA Emergency Use Act. Here's your instructions that comes with the kit. All right. It comes with a Band-Aid, not that you really need it, alcohol swab. But here are the things that you absolutely got to have. This is the buffer solution, okay, that makes the test work. And here's the little finger prick. It's like checking your finger. If you are diabetic or if you've ever done a finger prick stick, it's exactly the same thing. That's why when I saw this, I was like, this needs to be a home test kit because that's how we're going to get through this. Then I had all the other stuff designed and made, right? What I do is I open up the Band-Aid first. Not that you need it, but I like to open it up there. Okay, I'm going to test myself here real quick. I open up my alcohol. Oops, right there. Right there. Okay. All right. I get all my solution down. Okay. Now here's the test kit. So when you open it, you're going to see in here, here's the test. It's going to look like that. All right. So we'll put that down here. And it will also have a pipette in here. I like this test because it has this pipette. And you can use this pipette to kind of suck up blood, but I use it for the buffer, right? So I'm just going to open this up. I'm going to put my pipette in here, and I'm going to squeeze the bulb, suck up all of that fluid, suck up all that buffer. You see it's all sucked up in there, all right? And then I'm just set it down. Take my alcohol swab. Decide which finger you're going to use. I'm going to use my middle finger. And if you have a callus, you want to go off to the side a little bit. So I'm just going to go off to the side right here a little bit. From, you know, if you have callus from hard work or playing guitar or whatever stuff. So here's the lancet. This is called a lancet. It'll look something like this. Might not be this exact one. You take off the lid, right? The needle is in here. It's a tiny little prick. You're just going to put it down and you're just going to press it. Just press down. Okay. 1, 2, 3. And then you see the blood coming. It does not hurt. It's like just a little prick. I mean, that's it. Okay. And you want to get a nice drop of blood here. All right. And then this has 2 wells in it. You want to use the top square one. All right. So I'm going to literally just take my finger and swipe my blood down in there like that. Boom. Just got it in there. First try. Good job, DRV. Okay. Now with this, if you have some blood going, I just take an alcohol swab there. But you see, it's already stopped bleeding. It's such a tiny prick, you don't really feel it. And then if you want a little Band-Aid because you want to show your, you know, your wifey or somebody that you're tough, you can do that. Now, what I'm going to do is just take this buffer, okay, and I'm going to drop it in the bottom well. So the round well is the buffer. And I'm going to drop most of it in there. We say 2 big drops, but I find people have not been using enough of it. And now, if your blood is not in this buffer well enough, the top well, you can also put a couple of drops up there and then just help it down, okay? You don't have to do that second step, but if you're having trouble, if it's caught along the side, you can drop some buffer. That's it. Set the alarm. Now look, I'm going to set the timer. Now look, I want you to watch that. You see the buffer is making its way up. So what it's going to do is it's going to change that blue line to pink. And once it changes the blue line to pink, that means you have a valid test. Then you read the results in 10 minutes. If this line does not turn pink within 2 to 3 minutes, you need more buffer. Put more buffer. All right. It has an IgG that tests for old past infection, and IgM right here, the M stands for IgM, that will test for active infection. So I'm going to put this away, and I got the timer going, and that's it, guys. And I'm going to read the results. You don't send it to a lab. You don't send it to, you know, you don't have to have any special equipment. You're just going to read it like a pregnancy test. Okay, the lines turned pink right there. See it? It's already started turning pink. So you know it's going to be a valid test so far. And I made this reading sheet for you, and you just basically going to read all this stuff along here. What you want to see is the negative. Just all you want to see is the control line, not the IgM or the IgG. Okay.